injecting their inhalers or steroids. And some have come into the emergency room and have even been hospitalized because of the exposures.
Well, between the extreme heat and the multiple wildfires burning across the state, Coloradans have been battling some intense weather conditions recently. And while being outside may be uncomfortable, it may also have a lasting impact on your health, especially with smoke from those fires filling the air. Joining me now for a closer look at those health concerns is Dr. Joe Ponce, an ER physician at AdventHealth Porter. Dr. Ponce, thanks so much for being here today.
Well, thank you guys for having me and giving me the opportunity to talk.
Absolutely. This is such a big talker right now. I'm curious from your perspective, what are the biggest health concerns you want viewers to understand when we talk about wildfire smoke in the air?
That's a great question. And I think one of the biggest things is just knowing that although you look out the window, you may not see a fire directly in the vicinity, that these health effects are far-reaching. The smoke comes from hundreds of miles away and can affect lots of people, even if they don't have underlying health conditions.
Yeah, I think a lot of us have noticed that kind of raspy feeling in our voice. That's the obvious one. What sort of other health impacts should people watch for that may indicate smoke exposure, things that might be affecting their lungs or overall health?
Right, yeah. So when I think about kind of the symptoms that you'll tend to see with smoke exposure and bad inhalation of these dust particles and pollutants, I kind of group them into two major categories, either mild to moderate symptoms and then more severe ones. So the ones that you kind of described, itchy eyes, scratchy throat, maybe some dry cough and some wheezing, those are more mild and moderate symptoms. Those are ones to definitely monitor for, but I want people to be on the lookout for anything that causes chest discomfort, chest pain or tightness, or even severe difficulty breathing. Those are the big ones.
Okay, that makes sense. And I imagine there are certain groups of individuals who are at higher risk for this.
100%. Number one, it's anyone with really underlying chronic lung disease. So that falls into an array of different conditions, mainly asthma, COPD, people with like infiltrative lung disease. So anyone who's on chronic medication or treatment for a lung disease should watch out and always make sure that they have their rescue medications, their inhalers readily available.
Of course, limiting the amount of time you spend outside is a key takeaway from this. What are some other practical steps that folks can take?
Sure, like even indoor things. So to make sure that, when you are staying indoors, you have your windows and your doors properly sealed, and make sure that when you're running your HVAC system that you have high quality, good air filter in place so that you make sure that you're getting those contaminants that do perhaps get into the house out. The other things to do is, you had mentioned staying outside. If you have to go outside, try to limit the time you're there, and then also use a face covering. So the most effective one would be like an N95 mask, because those filters are high quality and they have a better chance of catching all the pollutants from the air, more so than a normal surgical or cloth mask.
I think back to 2020 and how bad the air quality was then compared to now. At the time, doctors were talking about people coming into the ED. I'm curious, are you seeing that right now with the air quality that we're seeing right now? Are you seeing people come into the ED with symptoms of this?
100%. Even in some of the urgent cares that we work, we're seeing a lot of people come in with very mild symptoms, like their eyes are very itchy, clearing the throat a lot, very sore throats. But in the ER, we are seeing a lot of our patients with the chronic lung disease that I mentioned earlier come in with more frequent symptoms and more severe symptoms.
That makes sense. And to close there, at what point should somebody start to recognize that they've moved from that moderate to severe category and that they should come seek medical care?
Great question. So anyone who's having any kind of chest symptoms, like, the chest is tight or there's pressure or any kind of pain, wants to go to the ER. Or if you're breathing heavily, you feel like you can't get a deep breath in, those are signs of early respiratory distress. And if you're having persistent shortness of breath, those are definite signs that you need to go to an ER and get evaluated.
Great advice. Unfortunately, this could be an issue for weeks or months to come with how many fires we have burning. So, Dr. Ponce, I appreciate the insight this morning.
Of course. Thank you so much.
Absolutely.